What is breast cancer? Breast cancer is one of the most common cancers in women, but it can sometimes affect men. Breast cancer occurs when some breast tissue cells grow rapidly and reproduce abnormally to a degree where they are out of control, constituting a lump mass in most cases. These cancer cells continue to invade neighboring healthy cells in the breast if untreated and eliminated, and may extend to nearby lymphatic nodes as breast tissue can penetrate and spread into nearby organs, possibly reaching distant parts of the body. Breast cancer usually originates from the lactic glands responsible for the secretion of milk, breast lobes, or from pathways that transfer milk to the nipple, mammary channels, and can sometimes also arise from fatty tissue or fibrous connective tissue within the breast. Grade 0, also called non-invasive or local breast cancer. Although these tumors do not have the ability to invade healthy tissue in the breast or spread to other organs of the body, it is important to eradicate and remove them, because they may turn into invasive tumors in the future. Grades 1-4. Invasive tumors have the potential to invade healthy tissue in the breast and then spread to other organs of the body. First-degree cancerous tumor is a small and local tumor, and the chances of full recovery from it are very great. But the higher the degree, the chances of recovery. Grade 4. It is a cancerous tumor that has moved out of breast tissue and spread to other organs of the body, such as lungs, bones, and liver. And although cancer cannot be cured at this stage, there is a possibility that it will respond well to various treatments that will cause the tumor to shrink and diminish and keep it under control for a long period of time. Awareness and mindfulness of early symptoms and signs of breast cancer can save your life. When the disease is detected in its early stages, the range of treatments available is wider and more diverse, and the chances of full recovery are very great. Most of the lumps detected in the breast are not malignant, yet the most common early sign of breast cancer in both women and men is the appearance of a mass or intensification of breast tissue, which is often painless. Release of a transparent or blood-like substance from the nipple, sometimes appearing with the onset of the tumor in the breast. Drop the nipple or teeth it. Change the size or features of the breast. Flatten or teething the skin covering the breast. The appearance of redness or what looks like curly skin on the surface of the breast, such as the orange crust. Breast cancer means that a number of breast cells are beginning to reproduce abnormally, and these cells divide more quickly than healthy cells and can begin to spread throughout the breast tissue to the inside of the lymph nodes and even to other organs of the body. The most common type of breast cancer begins in milk production glands, but it is also possible to start in one of the subclaves or in other breast tissues. In most cases, it is not clear why healthy cells in the breast tissue turn into cancer cells. Inheritance. 5–10% of breast cancer cases are due to genetic causes. There are families with a defect in one or two genes, such as breast cancer, gene NO1, BEEEE1, or breast cancer, NO2, BRCA2, DA. This is very high risk for their sons and daughters of breast cancer or ovarian cancer. Other genetic defects, like the Barley expansion gene and the gene number 53, responsible for the stoning of all tumors, increase the risk of breast cancer. If one of these genetic defects is present in your family, there is a 50% probability that the imbalance is present in you too. These acquired defects may be attributable to exposure to radiation, such as women treated with radiation in the chest area for treatment of a Levi tumor in childhood or adolescence, or breast development, who are more likely to develop breast cancer than women who have not experienced such radiation. Genetic changes may also occur due to exposure to cancer-causing substances, such as some hydrocarbons found in tobacco and charred meat. Today, researchers are trying to find out whether there is any correlation between a particular person's genetic composition and environmental factors that may increase the risk of breast cancer, and may prove that many factors may cause the onset of breast cancer. Breast cancer risk factors. Risk factor is anything that increases the likelihood of a particular disease. Some risk factors, such as age, sex, and family history, cannot be changed, while human beings can control other factors, such as smoking or malnutrition. However, even if you have one or more risk factors, it does not necessarily mean that you have breast cancer, as the majority of women with breast cancer have only developed because they are women and do not have any additional risk factors. Being a woman is the most important risk factor for breast cancer, and although men are also at risk for breast cancer, it is much more common among women. Other risk factors that can increase the risk of breast cancer include age or a personal history of breast cancer, family history, genetic tendency, exposure to radiation, excess weight, menstruation is relatively early, reaching menopause at a relatively late age, hormone therapy, take contraceptive tablets, smoking, pre-cancerous changes in breast tissue, high density and mammography tissue. Age and the specific period of menopause may affect breast tissue density, as the density of breast tissue in young women is usually higher than in older women. Hormones also have an effect on this. The higher the hormone levels, the higher the breast tissue density, although the risk of breast cancer due to the higher intensity of breast tissue increases by only a small proportion. If you are in one of the groups most vulnerable to breast cancer, and your breast tissue density is high, it can be difficult to analyze radiography, and then your doctor may advise you to perform other scans. Cause of emergence of tumors that are not malignant in the breast. There are medical conditions, other than breast cancer, that can lead to a change in breast size or tissue. Breast tissue naturally changes during pregnancy and during menstruation. Other possible causes of non-cancerous breast tumors include fibrous cystic changes, conditioning, fibromatosis, inflammation, or injury. Complications of breast cancer. Complications include anatomical changes of the breast, chronic pain, phantom breast pain, and linear web syndrome, lymphedema, fatigue, and cognitive impairment. If you notice a lump or change whatever in your breast, even if the result of the recent mammogram is intact, you should contact the doctor to assess the situation. If you don't get past menopause, it may be better to wait for one menstrual cycle before reviewing your doctor. But if the changes in the breast do not disappear after a month, it is necessary to go to your doctor to assess the situation. The most important methods of diagnosis include the following. Searching for evidence of breast cancer before the onset of the first symptoms is key to early detection of breast cancer when it is still at a stage where it can be treated. According to information about the age and risk groups to which it may belong, mammography or other examinations are performed. Breast self-examination is only one possibility and must be performed permanently and regularly from the age of 20, as your breast self-examination experience, your knowledge of tissue and breast structure on a permanent and regular basis may make you able to detect early signs of breast cancer. You should learn how your breast usually looks and be vigilant for any change in sensation or breast tissue. If you notice any changes, you should inform the doctor as soon as possible. If in the family you have developed breast cancer, or if you belong to one of the most vulnerable breast cancer risk groups, you are advised to undergo breast screening at the clinic once every 3 years until you reach the age of 40, then at a rate of once a year later. During this examination, the doctor inspects the breast tissue to look for lumps or other changes in the breast, where the doctor can detect lumps or changes that you could not pay attention to, and can also observe an increase in the size of the lymph nodes found in the armpit area. Mammograms that examine breast tissue through the production of X-rays are today the most reliable screening for early detection of cancerous lumps in the breast, even before the doctor feels them by hand touching the breast. For this reason, it is recommended that this examination be carried out frequently for all women over the age of 40. There are 2 types of mammograms: breast scan diagnostic mammography. But radiography examinations are not ideal. There is a certain percentage of tumors, and sometimes lumps that can be sensitized to self-examination, and do not appear in X-rays. This proportion is higher among women in their 40s. This is because women of this age and younger women are more inclined to have a higher density of breast tissue, making it difficult to distinguish between healthy and unsound tissue. Examinations to gradually graduate the seriousness of the disease by which the size and location of the cancerous tumor is determined, and whether the tumor has been transmitted and spread elsewhere, and progression also helps to plan therapeutic procedures. If you find in the family a genetic condition or more breast cancer, blood tests will help detect the defective gene or defects in other genes transmitted from generation to generation in the family. These tests often yield inconclusive results, and must therefore be carried out only in special cases and after consultation with a genetic consultant. If you are not in the risk group for breast or ovarian cancer against a genetic background, there is no overall need to perform genetic diagnostic tests. Genetic diagnosis can be useful in most cases only if the results of the examination will help you choose the best way to reduce your risk of cancer. Informing you that you have been diagnosed with breast cancer is one of the most difficult experiences a human can experience. In addition to facing life-threatening disease, you have to make decisions about a treatment program that is not easy at all. You would prefer to consult with the medical team on options for breast cancer treatment available, and would prefer to have a second opinion from a breast cancer specialist, and it would be useful to talk to women who have experienced similar experiences. Today, a variety of treatments are available for each stage of the disease. The majority of women undergo surgery for mastectomy as well as chemotherapy, radiation, or hormone therapy. There is also a variety of experimental treatments for this type of cancer. Mastectomy has all become a rare procedure today. Instead, most women are excellent candidates to eradicate the affected part of the breast, or only to eradicate the tumor. If you decide to completely mastectomy, you may later consider a breast reconstruction process. Surgeries to remove cancerous breast tumors include: surgeries to eradicate the cancerous tumor are always followed by radiation treatments in order to destroy any cancer cells that may have stayed in place. Since breast cancer spreads primarily towards the underarm lymph nodes, all women diagnosed with invasive type cancer must undergo an examination of these glands. Many people who suffer from cancer are treated with radiation today, some of which are limited to treatment only while doctors and others go with other treatments such as chemotherapy. The primary goal of radiotherapy is to reduce the volume of tumors and kill cancer cells. While radiation may also target healthy cells, it is not necessary to get damage to cancer cells, as healthy cells have the ability to resuscitate themselves. The effectiveness of chemotherapy in eliminating malignant tumors may outweigh surgery and radiation together, because of the ability of chemotherapy to reach all parts of the body, and not only to specific places, such as surgery or radiation. Sometimes a cancer patient gets doses of chemotherapy with the aim of reducing their tumor size before having surgery to remove it, or before starting radiotherapy sessions. Chemotherapy targets genes and proteins, especially in cancer cells, that destroy them and prevent the growth of new tumors, as well as preventing food from reaching them from blood vessels. Ablation of the armpit lymph nodes. If there are signs of a cancerous tumor in the guardian glands, the surgeon should remove all the underarm lymph nodes. Reconstruction and breast reconstruction surgery. If you wish to undergo surgery to rebuild and restore your breast, talk to your surgeon before performing any surgery. Not all women are suitable for breast reconstruction surgery. Plastic surgeon can advise on a variety of operations. Display photographs of women who have undergone different procedures aimed at breast reconstruction, and you can consult with him to choose the type of operation most suitable for you and your condition. Options available to you may include reconstruction by implanting artificial tissue or transplantation of your tissue, and these surgeries can be performed during a mastectomy or later. Breast reconstruction and restoration types include implant, synthetic fabric, folded personal tissue, deep inferior epigastric perforator, DIPE, ... rebuild the nipple area and breast aura. 4. Hormone therapy. In case of hormone-sensitive cancer, Hormone-accounting therapy may be offered by medication, such as tamoxifen or aromatase inhibitors. This treatment stops the release of estrogen. 5. Biotherapy. As scientists and researchers gain more knowledge about differences between healthy cells and cancer cells, treatments are developed aimed at addressing these differences, where treatment is done on a biological basis. There are 3 types of biological treatments available to treat breast cancer, including trastuzumab, bevacizumab, docetaxel. Prevention of breast cancer. Nothing can guarantee that there is no breast cancer, but there are many steps that can be taken to reduce the risk of breast cancer, including what comes. 1. Prevention by chemical means. Prevention by chemical means means the use of drugs to reduce the risk of breast cancer, as there are 2 types of drugs used to prevent breast cancer in women, who are more likely than others to develop breast cancer. These drugs belong to a class of drugs that selectively occupy the estrogen receptor, selective estrogen receptor modulators, SERM, tamoxifen, raloxifene. 2. Surgery as a preventive measure. Although surgery is an exaggerated procedure, surgery as a preventive measure can reduce the risk of breast cancer in women at higher risk of the disease. Options include mastectomy as a preventive measure. 3. Lifestyle changes. Taking some steps to change your lifestyle can be an influential factor in reducing your risk of breast cancer. Avoid alcohol intake. Maintain a healthy weight. Avoid long-term hormonal treatments. Exercise physical activity regularly. Eat high-fiber foods. More olive oil consumption. Avoid exposure to insecticides.